My name is Lolita Dixon. I am a division manager with a luxury retailer in the Bahamas. I am a proud mother of 2 adult girls, and some of the things that I love: traveling, reading, and a good cup of coffee.
Hi, my name is Nikia DeVoe Christie. My claim to fame is that I am an Olympian, and I'm going to hold on to that until the end of days. I am also the director of marketing at Nassau Paradise Island Promotion Board, and I am a devoted wife and mother of 2 little active boys. I'm also passionate about fitness. I'm a junkanua, a proud Valley Boys member, and I love to travel and I enjoy eating. So that's what clashes with the fitness.
Hi, my name is Dekel Quant, also known as Bowflex Barbie. I am a fitness instructor by profession. I am also a wife, a dog mom, a stepmom, and I have been in the fitness space for the last 16 years, personally and professionally since 2017 full-time. I love working, especially with women, to help them look and feel amazing.
When I was approached about the podcast, it really piqued my interest because we were talking a little bit off camera. There's a group of girlfriends, and we are all reaching a milestone that, again, I don't want to say out loud to make it real. So we're all reaching a milestone, and we all have these different things that we're experiencing, and it helps so much when we get together as a group and talk about it, right? And then I also have friends who are younger who benefit from the conversation, and I have friends who are older who I benefit from their conversation, and they benefit from mine. So I thought, okay, I've had health issues, I've had challenges with weight loss, I'm still having challenges with weight loss. I have friends who are having serious issues with pregnancy, fertility. There's so many different topics, and it always helps when we get together and talk about it. When people start giving advice, when people start realizing that they're experiencing the same thing, right? So this is a way that we can share and we can rally together and we can let other people know that they're not alone, right? They're not alone in the struggle. There's always someone who's in the same struggle or even having success stories about their health. And I thought, wow, what a platform to just get on there and just talk, right? And this is how we can help people. And of course, having expert advice along with those conversations, right? Because I'm definitely not an expert, but but I'm definitely experiencing things, and I have experienced things with pregnancy, and it's just a good way to share information and to help. Right.
Yeah, I think it's just a great way, like you said, to share information. And the more that you share, the more that you learn. I think it's listening, also, giving the knowledge that you have. We've all had health experiences, health challenges, and again, having the expert that can bring and tie everything together. I think that's so important.
I always look for ways to add value, especially to women. So once I knew that it was for women, I was already like, let's do it. And when I learned about the concept of, sharing on the topic of health, I just think there was a big connection for me in fitness and kind of bridging that gap between how fitness can be that preventative tool for a lot of things. A lot of times the diseases that we see locally especially are from, lifestyle, just lack of activity, and living too sedentary of a lifestyle. So just hopefully adding some value to the conversation in that space. We talk about hitting milestones. I hit, the 30 is a milestone.
That's a baby!
I woke up on my 30th birthday, knees hurting. So I mean, but I think I think people, women, regardless of where they are, I think will get value from, learning whether it's women older or younger than them have gone through, are going through. And I think if they can't relate to it personally, they could share it with someone that they know they love.
The 3 of us are up here chatting about health issues and all this, and people are going to say, well, they're not the experts, but, the experts are bringing this show to you. Doctors Hospital had the vision. And I think it's a great idea, a very clever way to reach an audience that really needs to have this information. And we're going to be joined by health professionals, not just us, right? And so, I mean, this is what a great idea, right? To talk about health in a fun way, because, like I said, we're fun. So to address these issues in a casual, relaxed setting where it's just a conversation. You're not sitting in a doctor's office and they're saying to you on your chart this, that, and that's important as
Right.
well. But it's good to start thinking about these things, your health issues, in a way that's easy to digest.
relatable.
So it's a really great idea, a great way to bring together healthcare and fun people.
Yeah, I agree. I think for me, I really love that. You know, I hear a lot in fitness, people think that they have the stigma around like the medical care system, that it's designed to not be, not keep you healthy, but take care of the sickness. Like it lets you get sick so you can now go and be taken care of. But I think something like this allows you to plan and, again, be more preventative than reactive to your health, and not allow whatever's going on to get to the point where you need to go to the extremes of now taking care of it. So I love that doctors had the initiative to, create the space for women, especially. A lot of times I feel like women we're kept in that March box,
Right.
and y'all have y'all month to celebrate, and then let's move on.
Yeah.
So I think something like this keeps the discussion going, and allows women to, again, have that safe space in a digestible and fun, light way.
Night.
Yeah, I agree with both of you. I think it's a great idea that they're bringing healthcare into a space for women that is very relatable. You're having conversations, questions that they would have can be answered in a very, relatable way. So I think it's really important that I think women will get a lot from this particular platform.
Kudos to Doctor's Hospital.
At Doctor's Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off lab, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctor's Hospital, trusted and best care now.
As a fitness professional, what I see a lot, especially with women that are 30 and up, I feel like a lot of times they're reactive instead of proactive when it comes to health. And reactive sometimes in that they don't they're at a point maybe after having kids or going through, that 20s stage of life, getting to that point, they feel like, hey, now I have either the finances, maybe a little bit of time, or just this now motivation to look better. Or it's, I've gotten to this point and life has lifed, and now I'm fighting, I'm maybe pre-diabetic,
Right.
or I'm now starting to see the genetic trends of my family show up in me. And so now I'm reacting to, I did my annual and this is stuff that
Right.
the doctor told me I need to now focus on. My health, I think that's something that I think is unfortunate. Like we tend to be, as women, sometimes reactive and kind of just putting out the fires as they pop up, versus being proactive and trying to avoid some of those things.
And I almost think it's a cultural thing sometimes, and I know especially as you mature, there's certain things that we don't discuss. We talk about, puberty, we talk about having children, but when you get to a certain age, we do not talk about the elephant in the room, which is menopause, hormonal changes, and it is dramatic. And I've always wondered, why is it not more of a conversation that we're having culturally? And I think there's some possibly shame that comes along with it. And I think it's something that we really need to discuss more so that women can feel good in their bodies as they get more mature.
Yeah, and I think there's a lot to go with that. Dekel talked about having the families, becoming a parent, right? And when you become a mother, nothing is about you anymore, right? Your focus is on family, on kids, and then you wake up one day and either you're 3 sizes bigger or more, or now all of a sudden, you realize you haven't prioritized your health, and then you talk about these other issues with aging and the shame that comes along with that, right? Talking about it makes it real. Finding out about it makes it real, and then also, it's, am I going to be valued as much now that I have these issues that are associated with age and being an older woman? And all of that, I think, plays a role on why women aren't as proactive about their health, and or you could be someone like me that doesn't realize that you are the age you are until things start to hit
And
you in the
things
face.
start to happen.
Right? When I
Yeah.
have to remind myself, like, you're not as young as you think you are,
Exactly.
right? Like, I don't realize that I'm not 20 until I start talking to a 20-year-old or start
So things are
or
different.
thinking I could do 20-year-old exercises and
Right.
things that I used to do. So, there's a lot of, it really should be prioritized more. And the women aren't only to blame. I think in the healthcare system, it really should be
Absolutely.
prioritized more. With our bodies, women's bodies are so complicated. We have so much going on, and it's not talked about enough.
Yeah, I just think when we go to the doctor, we need to feel more empowered. We need to go with questions. We need to not be afraid to ask those questions, things that are going on with us, and having those discussions to really get to the bottom of it.
Yeah, I think like Nakia said, even for me, like I have a history of breast cancer in my family, and I remember my first like breast ultrasound being pre-30, and my doctor was like, like the doctor I went to do it with was like, "Why are you doing this?" I was like, "Well, because I want to do it," and they kind of were like, "No, you don't need to do it. You're not at the age yet." And I was like, "Look, I will feel better. Like, y'all don't want my money. Like, I would feel better if I did it." And so. But even that, like, it took me a while to build up that courage because, like, well,
To
now
advocate for yourself, absolutely.
to advocate for myself, but also kind of like to even want to do it because I'm like, if I do it and I
Right.
see
Wow.
something, like now it's real. Like
Yeah.
you said,
Now
it's
you have
like
to face the
I have to
reality.
face it. Even doing the BRCA gene exam, it was like, well, if I know, like, now I have this
What do you do
decision.
after that?
Yeah,
Yeah.
like what do I do after that? So like, I feel like a lot of people sit in that space when it comes to like, do I want to go to the doctor and find out something's wrong, or do I just live in this like ignorance is bliss state? Yeah.
And another way that women do themselves a disservice, right? We power through, right? We're really strong. And we know that, okay, I have an ache, I have a pain, it'll go away, or I have these other things to do. I have a meeting, I have school pickup, the children
still
to
gonna do
play,
it.
we gotta, I don't have time, right? I'm always getting fussed at. Like, you need to make time for these things that are priority. You need to go and see a doctor. But I'm just powering through, right? There are other things that are higher priority. Right, the kids, something at home, my job, these things all. When I'm done with all that, if I find time, then I'll make an appointment, and and then that can gets kicked down the road over and over again. So we need to do a better job of supporting each other and encouraging and listening, right?
But
listening.
I feel for me, like when I hit a certain age, like a switch flipped. Like I knew that there were certain things that I was going to take care of for me. My kids were grown, and I said, you know what, it is really my time. I'm an empty nester now, which feels great. But, it was really that thought process where I know that I have to start prioritizing some things. I'm not getting any younger. I was telling Kel that I started to get joint pain, and I just like, oh, maybe I have a little injury. Maybe, I'll take a rest off this week. Couldn't do my squats. And then I'm like, try going back to them, and I said, oh, I still can't do these. So then I realized, okay, something else is going on, and that was a part of the hormonal change. It can really affect your joints. It can affect so many things in your body overall. So it's really important to start paying attention to them and really prioritizing yourself, because you can't be that full whole person for anybody else until you are fully taken care of. So that's how I look at it now.
Yeah, and I think we need more platforms like this as well, right? A headache, you have all of these different symptoms that on their own, they may not be a big deal, but now as they add up, if you speak to someone about it, they'll say, oh, this is a sign of X, Y, Z. So if you have somewhere where there are people talking about all of the symptoms of things, all of the possibilities, all the things you didn't even know existed, we just need to have those conversations.
Absolutely. I really hope that this show appeals to most women, because I think there's so much knowledge to be gained from it. Anyone that's interested in their health care, anyone that's interested in taking better care of themselves, interested in community, I think the show would definitely appeal to. It would be a great resource for them.
Yeah, and what I hope is that, they realize that these things are not embarrassing, right? We're going to talk about some things on here that people may consider embarrassing, but these are things that women, going through life, you're going to experience, or you may experience, or someone is experiencing. So I hope that we'll take away the stigma of certain health topics, the stigma of certain issues that women deal with, and we start to open up your eyes and start that, make sure you have that conversation in your spaces, right? Join us in our space while we have that conversation conversation, but we hope that you start the conversations in your own spaces.
This is going to be a great resource for women, but also for men too. Men are, whether it's husbands, partners, dads, like these may be conversations that could be beneficial to them in helping the women they love in their lives too. And so I do hope that men aren't, afraid of sitting in on the conversation. Y'all allowed a little bit, y'all allowed. Because I think it can also help them add value to the women in their lives too. And like you both said, I think it's going to be a learning experience, but also proof that you're not alone in your struggles, whether you're going through it currently, you've gone through it, or, you never know. You never know what life has down the road, but at least this podcast will hopefully equip you to deal with whatever.
Plus, we're fun to hang out with, so,
Yes.
You
just
should
hang
lead
out
with
with us,
that.
right?
You should lead with that.
Yeah, we're going to have plenty of fun. So, while talking about serious issues. So I think it's a show you shouldn't miss.
I agree. Can we cheers to that?
Cheers.